Highlights from my guide to surgery, part 1. So what is a mnemonic for causes of fever after surgery? This is the famous wind, water, wound, walking, and wonder drugs mnemonic. Atelectasis, UTI, wound infection, DVT or PE. And if at any point it's unclear where the fever is coming from, you should start wondering about drugs being a cause of fever. One thing to note is that atelectasis has actually never been proven to be a cause of fever itself. What is it called when there's no bowel movements immediately after surgery? That's called ileus. The most common electrolyte cause of this is hypokalemia. What is it called if somebody's not having bowel movements several days after surgery? That would be a small bowel obstruction. So this would be somebody who's having bowel movements after surgery, leaves the hospital, and then comes back a few days later or years later even, and is not having bowel movements, and that would be a small bowel obstruction. The most common cause of small bowel obstruction in adults, this is a question you will definitely be pimped on, so very important to know. Adhesions, so surgical scar tissue from the past. Most common cause of small bowel obstruction in kids would be hernias.